Being nominated as a Castle Connolly Top Doctor for me is particularly special. There are a lot of award programs out there, but this is one where your peer, other physicians have recognized you as being somebody special. And, being a top doctor in medicine today isn't just about knowing the science. It's about going above and beyond for your patients, making sure that they feel listened to, feel heard, and that their needs are met. The fact that this is a peer nomination really means a lot to me. And, the people that nominated for me for this award are people that I respect. They're mentors. They're people that I have looked up to over my career. And so that's something that makes this award particularly special. So what brought me to medicine and to anesthesiology? I grew up in Wilmington, Delaware. My dad was a dentist. My mom's a psychologist. And I always knew I wanted to do something in healthcare. And in college, I decided I wanted to go to medical school. And in medical school, I just fell in love with anesthesiology. It was the only thing that I didn't want to go home at the end of the day. And I felt like I could really have an impact. I love being in acute care settings where there's a fast-paced environment, a lot of things happening. And that certainly is what goes on in the operating room. And there's just nothing more rewarding than meeting a patient, seeing them so anxious, getting the medical information that you need out of them, putting your hand on their shoulder, getting them through a really, really difficult time, and then watching them leave the hospital without a tumor and knowing that that only is possible because of what you contributed and are able to bring to the patient. And so for me, I find that very, very rewarding about anesthesiology, and I'm just delighted to be able to practice today. So where do I see the future of medicine going with respect to the doctor-patient relationship? There are a lot of external forces that are shaping and reshaping what that relationship looks like right now. Unfortunately, we continue to see tremendous legislative overreach, particularly in a post-Roe versus Wade era where more and more states are dictating how medicine is practiced. And we're seeing this in reproductive rights. We're seeing this in gender-affirming care, and it's incredibly problematic. We're also seeing a major shift because of technology and digital tools and AI devices and software and how those things change the interaction between a physician and their patient. It's so important to me that we keep the human connection at the center of the doctor-patient relationship and at the center of healthcare. And through my work at the AMA, we're trying to make sure that we keep lawmakers out of our exam rooms and we make sure that technology works for patients and physicians to support that relationship, not try to replace it. So how is AI going to change healthcare? I think it's going to be transformative. I think we're going to see AI automate a lot of mundane things that drive doctors nuts that will let us turn our attention back to patients, which actually is where we get joy in medicine at its foundation. AI is fortunately, I think, going to be really helpful on the diagnostic front. I think it's going to make us more effective clinicians. I think AI is going to make it more accessible for patients to actually figure out how to navigate the healthcare system, which is only growing more and more complex by the day, making it easier for patients to engage in their own care and take care of themselves. So a lot of exciting use cases. Almost 3 out of 10 doctors today are using AI in their practices. I use it myself, and I expect that this is only going to increase. So what does it mean to be an LGBTQ physician? Well, growing up, I didn't know any LGBTQ physicians. So for me, being a physician who can represent the community, who can hopefully create an easy pathway for people to access care is so critically important. And I know how important visibility and representation are and mean to the community. And I hope that there are patients out there who see me as a visible out doctor and know that there's a healthcare system that will take care of them and they feel comfortable getting the care that they need. I know how important it is for patients to see themselves in their healthcare teams. And so that's why diversity in our healthcare teams is so important. And I can't tell you the number of times that I've walked into a patient's room and I've seen a same-sex couple. And when I tell them that I'm a gay physician, you just see their anxiety melt away. And so being able to help patients through a difficult time. So many patients, because of their identity, because of their orientation, because of their race, because of their gender, feel excluded, feel turned away. To be able to contribute to having more positive experiences is something that I think is a more meaningful part of my experience and journey into medicine. So health equity is near and dear to my heart, and issues around LGBTQ health have been such an important part of my professional career for almost 2 decades now. Certainly, the AMA's commitment through our Center for Health Equity is the actualization of a organization-wide commitment to making sure that all patients across the United States have access to high-quality, affordable healthcare. But we clearly have a long way to go. And certainly I'm appreciative of this recognition, because having a sense of who the top doctors are across specialties, across diversity, across the nation is a really important way for patients to know where they can go get trusted healthcare. So how can we improve the experience for physicians practicing medicine today? Well, we've got to do a couple of things. One is we've got to systematically get rid of the things that suck the joy out of the practice of medicine. Prior authorization, having to fax forms back to insurance companies, having to fight to get your patients the care that they need. We've got to make that easier. We also have to make sure that technology is an asset and not a burden. You know, the number one dissatisfier for physicians for years running was the electronic health record, because they were impossible to use and just added hours and hours of button clicking without getting much back that was really helpful. We've got to make those things easier. We also have to make sure that when physicians are burnt out, that they're able to get the help that they need. And the AMA has been working with state medical boards, with facilities to get rid of stigmatizing questions about prior diagnoses that are meaningless and do nothing but prevent physicians from getting the help and the care when they need it. So what's the patient experience like? You know, if you ask my patients, I'm sure that they would tell you that first and foremost, they feel listened to. And I'm a doctor who knows the medicine, who knows the science, who follows the evidence, but I'm also a doctor who listens, who gets down at the patient's eye level to hear what their concerns are, to make sure that they feel listened and cared for. And that's such an important part of the equation, not just the medicine and the science and the drugs that we take care of today.